Hello and welcome back to the next episode of Smileway Dental Facts. Okay, so come think about it. Today, what are we going to talk about?
Today we'll be talking about the difference between periodontitis and gingivitis.
Yes, a lot of people don't understand, the really real difference of that, because we have a lot of patients that come to us and tell us about,
we have gum pain.
Yeah.
Yes, but they can't differentiate what is the difference between a gum pain and the pain involving bone.
Yes,
that is the problem.
That is the problem. And also, what causes their bleeding gums and then bad smell from the breath and stuff like that. So we're going to cover all that today, all right? So first of all, the difference, okay, that if you have bleeding gums and if you have what I call a pain in the mouth or inflammation, we call it, swelling inside the mouth, most probably you will have infection inside the mouth, all right?
Yes.
And those infections can actually cause what I call gingivitis and periodontitis. What is actually gingivitis? Gingivitis is basically an inflammation of the gums.
The gums are swollen.
Yeah, the gums are swollen. Okay. Periodontitis is basically the second step of gingivitis. So it's an evolved of gingivitis. What it means that it's not just inflammation of the gum. That it doesn't just affect the gum, but it affects your bone as well.
The underlying bone.
Yeah, the underlying bone itself. So it's actually a permanent damage to the bone, and it's very difficult to regenerate bone. Of course we can, but we can't really predict how much we can regenerate your bone as well, right? Okay, so if you have bleeding gums, usually we're talking about gingivitis and periodontitis. Can you usually, Dr. Edwin, can you tell us more about how does usually happen? How it
usually occurs?
Yeah,
yes, sure. So, gingivitis, as we know, swollen gums, it originates due to a source of infection that is located within the gums. Usually, it is caused by dirt, and the dirt is over there due to food that have been left over, you didn't clean your teeth properly, or there's a source of infection due to bacteria that collects there for a long period of time, and it irritates the gums, which causes the swelling. And once there is a swelling of the gums, there is change in the color. Your gums will appear red. There's a change in the size due to the swelling, due to the blood, increased blood flow there. There's a swelling, and the shape of your gingiva, it will change slightly.
Yeah, because you see, talking about what you were saying, we have patients. Okay, I've seen patients that they have no idea why they have fever. You see,
the change in the local temperature.
It's because why? Because of all this inflammation, this swelling.
Your body is fighting the infection.
Fighting the infection. And do you know that inside our mouth, okay, there is difference between good bacteria and bad bacteria?
Yes.
So when you have bleeding gums or even bad breath, that shows that you have more bad bacteria inside your mouth compared to good bacteria. So when we come for treatment, or all this kind of thing, we are trying to promote the good bacteria and suppress the bad bacteria, isn't it? Yes. So the good bacteria can actually heal the mouth naturally
and cause less irritation and infection. So it's always good to balance the oral flora, so to actually help combat these infections. There are also a few probiotic strips that are available on the market to actually help to balance all these oral flora in your mouth.
Yeah. So when you come to the dentist, usually when you have this kind of problem, okay, that's the reason why 6 to 8 months you should always go to
come and clean your teeth.
Yeah, come and clean your teeth so that the dentist can check. Usually, when the dentist check, they actually have a different type of instruments, right? Yeah.
So this is a Williams probe that we use to measure the depth of a pocket. So a pocket is actually a depression where bone was supposed to be previously. However, due to infection, once the bone level reduces, there will be a pocket formation. The pocket actually depends on the depth. The deeper the pocket is, the more serious your condition is. And the more serious your condition is, it will lead to further problems such as moving teeth, there is pain when you chew, when you bite, and eventually you may lose the teeth.
Yeah, because you're talking about periodontitis,
Yes.
there are two different types. There is a localized, meaning that it's only on certain areas. And if you have general, basically it's the whole entire jaw. And we have a lot of problems when having these kind of cases. One, because a lot of people end up missing a lot of teeth. Right? And they're missing all the teeth, and then it's very difficult to save sometimes when it's actually general periodontitis. Because it can be due to genetics, but like we said, it can be prevented.
Yes.
Isn't it? Right? So some of the treatments are basically after we already know the pocketing of the tooth, the pocketing inside. We actually sometimes we clean the area, we put some medication, and what else can we do to actually strengthen the teeth itself? Right?
So there are a few kinds of immobilizers to immobilize the teeth to prevent it from actually coming out of its socket. So we call those immobilizers splints. So there are two types of splints that we can use. One is a flexible splint. Flexible splint, as flexible, it is softer, it's less fixed compared to the hard splint. For the hard splint, it basically just prevents any movement of the teeth. So depending on the condition of your periodontitis, we will choose these two different types of splint to fix your teeth and prevent any loss of your teeth in the future.
And also sometimes when you have a big swelling already, it may require root canal treatment.
Yes.
And at the same time, you will split and what we try to do to save the teeth. But of course, we all know that if you can't save the teeth,
you will have to replace it.
You have to extract and replace it. Right? But talking about that, there are ways to prevent it itself. Alright? Yeah, like Dr. Edwin was saying, probiotics, right? You have to take probiotics. You take multivitamins. And actually, some of these prevention, it actually starts from young. Alright? Just make sure you brush your teeth well, okay? Obviously, floss, and if you can use mouthwash at the same time.
Yeah.
Alright? One other thing that a lot of people here in Malaysia, they don't do is that they don't eat hard food when they were young. You see, if you do not eat hard food, you are not actually massaging the gums. You are not actually using more strength to bite. Basically letting your teeth to do the work. So if you don't like your teeth to do the work, our body is something like that. If you do not use it, you will lose it. Alright? So if you start eating hard food when you're young, crunch an apple, okay? Crunch pear, okay? Eat hard food, chew hard food, you will have less periodontal problems when you are getting older. Alright? One of the best things is that you start chewing hard food. Unless you're having mobility, then you can do it. Yeah? Okay. So anything to add, Dr. Edwin, before we...
So if you guys have any question and you are worried about your general condition of your gums, of your teeth, please do not hesitate. We are always here to assist you. If you have any questions that you want answered, comment down in the comment section below. And like, share and subscribe our video for further content.
Cheers. See you guys in the next time.
Bye.